According to the radiologist's report, this specific patient suffered a remote infarction in the right cerebellum. For this pathology, a brain without contrast was ordered because infarctions would remain unenhanced in post-gadolinium T1 weighted scans. The use of gadolinium contrast would not offer much information. With both the MRA and MRI of the brain, the radiologist concluded the cause of the infarction was because of her chronic small vessel ischemic disease. A stroke occurs when there is a sudden disruption of blood flow to the brain, resulting in damage to brain tissue. The two major types of strokes are ischemic and hemorrhagic. 80 to 90% of strokes are considered ischemic, like my patient, and are caused when stenosis, a thrombus, or an embolism blocks the arteries. In this case, it was a patient's significant atherosclerotic narrowing and occlusion of the distal right vertebral artery in combination with her high blood pressure that triggered the infarction. The vertebral arteries merge to form the basilar artery. The vertebrobasilar artery supplies the posterior 2/5 of the cerebrum, part of the cerebellum, and the brainstem. An occluded vertebral artery can cause many symptoms, including blindness and paralysis. In her case, she came into the ER with a left-sided facial droop, along with slurred speech. If a patient has a stroke or injury on the right side of the brain, the left side of the body manifests symptoms. The stroke occurred because of the small vessel ischemic disease. This disease is characterized by weakening of the arterial vessels of the brain. It is more prevalent in women and patients with diabetes or high blood pressure. Individuals with this condition are at increased risk of multiple strokes within their lifetime due to the plaque buildup in their arteries. Patients with small vessel ischemic disease often experience these leukener strokes due to atherosclerosis. The disease unfortunately contributes to cognitive decline and dementia. On MRI images, it can be seen as white matter lesions or cerebral microbleeds. After being in the hospital for 2 days, the patient was discharged into the care of her family. With these types of chronic diseases, prevention is usually the way to lower the risk of strokes. Patients can try to slow the progression of the disease by reducing their blood pressure and cholesterol. Maintaining a healthy diet is also very important.